KwaZulu-Natal Health Department is calling for calm as cases of hand, foot and mouth disease continue to rise in schools across the province. 168 cases have so far been confirmed, with the eThekwini district accounting for 120. All cases have been linked to primary schools and daycare centres. Newzroom Afrika's Phila Mthembu joins us now from one of the affected schools. Phila, good morning. One can only imagine the concern of parents and education authorities as this continues to become a growing problem. Talk to us about what's happening where you are and then what the provincial response is likely to be to manage all of this.
So, Iman, earlier on at around 7 o'clock this morning, we were live from Lenham Primary School. It's one of the schools which have recorded a high number of cases. So, news which has just come in now is that the KZN Health Department, MEC Nomagugu is going to be making her way to the school in Phoenix. The school has now recorded 89 infections over there, Iman. So, she's going to be at the school at around 10:30 this morning, just to also meet with officials and see a way forward with regards to coming up with strategies to mitigate this particular issue. We also did try to speak to the KZN Education Department to actually give us a comment with regards to this concerning matter, and they said that the KZN Health Department is now leading everything, which is why right now, because we understand that teachers are also impacted by this, which is why we are going to be speaking to the South African Democratic Teachers Union. I'm going to bring in Nomarashia Galusa to speak to us with regards to their concerns. I understand that there are quite a high number of educators that are part of this particular union, which are also concerned by the outbreak, Nomarashia.
Yes, it's true. Teachers have reported to us that they are scared of this outbreak, and we've tried to engage the department, especially because as you hear how it's circulating and getting all over the kids, especially in primary schools, is concerning because those are the young ones, and there's a special care that must be given to them, especially those who work with the kids have to be fully informed about how to handle the situation and how to ensure that there are no further infections that are taking place. So that is why, as the union, we are so concerned such that we started to engage the Department of Education from yesterday, because our concern is that the department has been silent on this matter, even though we understand that it's really the responsibility of the Department of Health to give guidance to the department. But at the same situation, the Department of Education has to come up with strategies, so that we are all informed, especially the teachers in those schools, to be informed how they can mitigate the situation. We all know that in KZN we have this challenge of water shortages, and one of the things that is highlighted in the circular that was released by the Department of Health last night is that there has to be high level of hygiene, and there has to be regular washing of hands and all of that. And we are just asking ourselves, in those schools that do not have water, what is going to happen? The fact that there's a school nutrition program that is running in schools, and also it's becoming clear from that guidance from the Department of Health that this can also move from one person to the other through changing or using and sharing of utensils, feeding utensils and all of that. So it means that even the people who are cooks in schools, who are handling the food for the kids, they have to be taken into confidence. They have to be trained so that they understand how they have to handle the situation, deal with the feeding of the kids. So that is our concern. We hope that we will be engaging with the department moving forward.
It's quite interesting that you mentioned the water issue. I know that there are a lot of schools which have issues with water supply. With that being an issue, and also with you being the union, what is it that you are going to be personally doing to ensure that the spread of this disease is mitigated?
Even without this disease, the issue of water scarcity remains a health risk. You'd remember that even institutions have to close down if there's no water. And the schools have been trying to continue with teaching and learning even without water, but under the circumstances, there's no way. The department must be clear to give guidance to those schools. They must just allow those schools to close because there's no water. And that is why it is important for the department to convene stakeholders, especially unions, so that we can discuss our own local ways of managing this situation, so that we are also briefed about the schools and the areas in KZN that are affected by water shortages.
All right. Thank you so much for your time, Nomarasha. Iman, quite interesting points being raised over there, especially around the issue of water supply. As we understand that there are many schools which are actually impacted by water supply, saying that since hygiene has been encouraged and that learners and teachers are being advised to wash their hands regularly to prevent the spread of this particular disease, how is that going to be achievable when there isn't enough water being supplied to schools? We can only wish that the department could give us a response with regards to these concerns. But as I've already mentioned, we are going to be speaking to the KZN Health Department MEC when she briefs the media at around 10:30 this morning.
All right, Phila, important updates for parents and families affected by this. So we'll keep you close to that story throughout the course of the day.